It's a hard day's night when you aren't getting a full night of shut-eye. For people plagued with sleep disorders, getting the necessary 7 to 8 hours of sleep is hard to do. An estimated 40 million people suffer from chronic sleep disorders, ranging from sleep apnea, narcolepsy, restless leg syndrome, and even sleepwalking. Faith Regional Health Services registered polysomnography sleep technologist Angie Liston says that sleep disorders should be taken seriously, especially if you know what to look for.
A lot of people come in just because they're tired during the day. They're very tired, they're sleepy, fatigued. Even at work, people find themselves like falling asleep at their computers and stuff like that. So those are definite red flags. Those are definite signs that probably something is happening while you're sleeping. Spouses, we get a lot of people in, their spouses snore, or they even witness them stop breathing at night and they gasp or take huge deep breaths and they snort when they wake up. So things like that, anything that they're physically seeing also.
The Sleep Disorder Center at Faith Regional has its own sleep lab inside, which is nationally accredited by the American Academy of Sleep Medicine.
Doing that just holds our lab to a higher standard. Not all sleep labs are accredited, and we are.
Liston says that sleep deprivation can lower a person's quality of life. It can also be a sign for something more serious. That is why Faith Regional has its own comprehensive approach of care with its in-house sleep study.
We do bring a patient in at night. We hook them up to lots of wires to monitor lots of different things. And they basically just come in, we get all the wires on, and we put them to bed. And they try to sleep as normal as they can. It's kind of hard with the wires, but usually people do better than they think they will. Once you fall asleep, you kind of forget the wires are there. So they sleep fairly normal through the night, and that's what we're doing. We're just trying to get like a picture of a normal night for them. We have 4 rooms total.
And obviously this is one of them.
This is one of our rooms, and most rooms are very typical to this. We have queen beds in all of our rooms. Each room has its own TV, its own thermostat for patient comfort, temperature-wise. We really pride ourselves on the rooms as far as making them very homey, comfortable. We don't want them to feel hospital-like when they come here. We want them to feel more home, like hotel-type rooms.
While the patient sleeps, their wavelengths are being monitored live.
Tonight, we measure a lot of things on patients. So we're looking at brain waves. That's how we tell if they're awake, asleep. We look at heart rate and rhythm. Oxygen levels is very important through the night. We also look at movements. If they have a lot of awakenings through the night, some people move legs and stuff a lot at night, so we look at that kind of stuff. But mostly what we're looking for, a lot of what we see now is like obstructive sleep apnea. So we're looking for times where they stop breathing or shallow breathe, and that correlates with oxygen levels. So we look for things like that. We also look at things like periodic leg movements. There are a lot of people that just move their legs, move their limbs sometimes at night. So when you see patients that are moving a lot, that are moving their legs or their hands, that's a REM behavioral disorder. So we look for that kind of stuff too.
But if you don't want to stay overnight at the sleep lab, you can also take a test home with you.
We do have a very good home sleep apnea test. And that's where a patient will come into the lab, and we do hook them up to most of the same wires. It's like the next best thing to coming in here. And what's different about Faith Regional is, as far as I know, we're one of the only ones that has this type of home test that is as extensive as it is. We are still monitoring brain waves, all those things that we monitor in the lab.
Liston says it takes about a week or 2 to get the results.
When they bring it back, we score it the same as we would a normal study. What's different about ours is when those come back, they are read by a local physician, and all of our physicians are definitely board certified in sleep medicine.
Liston says that the physicians and people are more aware now about the importance of sleep. She encourages anyone to call the Sleep Disorder Center if they have any questions.